I interact with many nurse practitioners and clinical nurse specialists who have their master's degree. And they pull me aside and say, I'm thinking I should go back for a doctorate, and I'm looking at all that work, and I'm looking at the costs, and I'm thinking, why?
And they said, we're moving to...
When we think about the role of the PhD graduate, it really is in the context of answering the questions that they've identified in their clinical practice.
Being in the field of geriatrics, you will very quickly identify a lot of issues that need to be solved. One of the ways that we do that in nursing is through research. So if, as part of your career, you've identified specific issues, the next step of your geriatric career would be heading on and obtaining your doctoral degree. That affords you the ability where you're still providing geriatric education, but now part of your responsibility is doing research as well.
The cutting edge of nursing today, in my opinion, is developing systems to support nursing care, to be able to deliver the care that we know we have the evidence or the research to support at bedside.
In the nursing home, maybe 20 or 30 years ago, everyone would have a urinary catheter in. And then some bright nurse came along and said, maybe that puts them at risk for having urinary tract infections. So then they did research.
But if you do not take your findings and disseminate them, you waste people's time.
We would still be going along with that same old procedure that we had 20 years ago that really wasn't as effective as what we have now.
So it's absolutely of paramount importance to get your findings out where they can be readily used. One of the fastest ways to do that is to use the venue called poster presentations. As colleagues walk by, they will interact with you. You have an abstract published. So people who are, say, trying to figure out the best ways to do mouth care in nursing homes will look at my findings and say, well, that worked and that didn't work, so I'm going to try this. So by the time they leave our doctoral program, they're ready to step up and present research confidently and in a way that the research can be used by others.
With a PhD, I think one of the things that's different is you're teaching your other colleagues. It's much more of a give and take. You're going to national and international meetings, you're presenting your research, which we might not typically think is teaching, but it really is.
And as a nurse educator, you can impact a bigger change because no longer are you a one-person change agent, but you can impact students who then go out and make further changes or advancements. There's power in numbers.
Pursuing my PhD has definitely opened new doors for me.
I probably find that I'm busier now than ever. There are more opportunities to do a myriad of things in terms of research and teaching, publishing. You're in a field that every day is a new frontier, that every day is changing.
Our knowledge base changes. What we know about nursing in general is changing with new medical technology, new medical advances. Teaching affords you the opportunity to change nursing by disseminating research out there that would hopefully change practice as well.
That's what is going to make people excited about their research, passionate about their research, because they can see how it can influence the quality of life of individuals that they care for.
I think that working with elders, it's just an opportunity where you can learn so much and give back. I learned just as much from an elder as they learned from me.
With older adults, you get to see all their wisdom, you get to see all their life experiences, and that is, not something you could ever put words to necessarily.
Seeing these students grow and develop over their careers, going from the first clinical experience where you're literally pushing them into a patient's room to see them caring for these very complex patients independently is just amazing.
If I can go home every day and feel like I made a difference, it's really a good feeling.